Hi, I'm Dr. Kurt Schreiber. Thank you for coming to our center for your upcoming visit. We're getting ready on our side, and I'd like to ask a favor of you to get ready on your side too. We have a paperwork task for you. When you first look at it, you're going to think, uh-oh, paperwork. I know that's how I feel when I go to my doctor's office too. But I want you to know this is really important. It's really important for us to be sure we've got a good handle on your current medical problem, your past history, and the more that we know, the better a job we can do for you. Many people think, oh gosh, I filled those papers out before, can't you just use what's on file? And the answer is, well, we could, but what we want to do is make sure it's up to date, that it's accurate, and that it's being formatted in a way that we can really get to the information for our visit to make sure it's accurate and we can do our best job. I'm going to walk you through this form. It looks bad when you start it because it seems like it's a lot of information. By the time you get to the end, I think you'll find it wasn't as hard as it looked at the beginning. But if you can please get this done prior to your coming for your visit, that would really help us both out. One thing I always like to know at the beginning is, what name do you like to go by? We see a lot of Roberts that are Bobbies, and sometimes we see Roberts that are Joes. And so what we'd like to do is be sure that we know, what name you prefer us to be calling you. That's right at the top of the form. As silly as it seems, it's kind of important to us. We'd like to know that. On your personal information, it's good to have someone help you fill out the form. Sometimes people have someone else fill out the form, but it's good for us to know, where did the information come from? Was it from the patient? Was it from someone else? So that we can be clear about the details on that. If you go through this, you're going to see something that looks a little bit odd when you first see it, but this is how neurologists think, and that is, are you left-handed, right-handed, or ambidextrous? As simple as that is, we'd like you to fill that out too. And we really want to know what your main symptom is, your main concern. We received the referral from your physician, advanced practice provider, and I want to be sure that we're all on track for what your main concerns are. So we'd like to know the symptoms that you have on the top of your mind when you get there. And we want to make sure that we're addressing any questions and things that you might have. And sometimes it's good to think about that before you come to the office so that we start off on the right foot, that we get right to it, and then we can address the questions and the concerns that you have right off the bat. Section 2 is your medical history. When you first look at this, it looks like a lot of stuff on this page, and it kind of is, but it's a good way to think through if you've ever had a previous medical problem that's been diagnosed or treated. What we're really looking for here is not symptoms. What we're looking for is, what's been going on in the past. What have you had? What have you been diagnosed with? What have you been treated for in the past? We start out with a table of a lot of different things, and it's easy to click through because it's either yes or no. But we would like you to think through those important medical and neurological questions to be sure that we don't miss out on those. Now, that table doesn't include everything that you might have, and so that at the end there's a place that you could write in or fill out extra information that would be important to know. So we're trying to capture all the information from your past medical history, things that have occurred up to this point that you've been diagnosed with or treated for. So if you could take just a few minutes to go through that, that would be super helpful to be sure we fill in that part of it. The next section refers to your past surgical history. And by surgeries, we mean operations, procedures, surgeries, anything of that nature. We put a few of the really big ones at the top, but that certainly doesn't include all of those. A good way to think this through is to think about starting from the beginning. Did you have your tonsils out when you were a kid? And then carry it forward over the years. A lot of people find that's a good way to think through and capture all the operations, procedures, and surgeries that they've had. Section 4 is your current medications, things that you're taking at home. Yes, it's possible we might have a list of your meds on file, but I want to be sure that we really have the meds that you're taking at home. So it's really good if you could look at your home medications and write down exactly what's on the bottle, tell me exactly how you're taking it. Some people wind up having their medicine changed and they don't exactly take it the way that it was prescribed. That's okay. We just want to make sure we know what you're doing, how you're taking your medicine, and make sure we capture all the things that you're currently taking. And we want to be sure we capture it from any doctor, any provider. And if you're taking over-the-counter or non-prescription treatments, we should know about those things too. So take a little time, bring out your medicines, go through it thoroughly, and please record the name of the medicine, the strength of the medicine, and really the honest truth about how often you're taking it. Sometimes people are saying, well, I'm supposed to take it this way, here's how I really take it. We want to know how you're really taking it. So if you could take a few minutes with your medicines to make sure it's up to date, that would help us a lot. Section 5, we're really asking you about allergies. Allergies are reactions to medication. Doctors usually think about rashes and other problems being allergies. Definitely don't want to miss those. Patients often think about medicines that made them feel poorly or ones that they just can't take. We want to know about those too. So we're going to lump both of those together. If there's allergies or intolerance, we'd like to know what medicines you have problems with, and if you can recall what the reaction was, that would be great to record there too. Section 6 is called social history. That's really for us to learn about you and your lifestyle and where things are at for you. That is important for us to know because we want to make sure that any treatments or plans, fit for you. And part of you is what's going on outside of the doctor's office and in your home environment. So if you could take a few minutes to go over your social history, that would be helpful for us as well. Section 7 really looks at your work history. The reason we ask those questions is that some of the treatments could affect people in their work environment. Sometimes people's work environment could have affected their medical condition, and getting a little bit more background on that part of your life can help us be sure we're shaping a proper treatment plan. Section 8 really looks at what we call lifestyle factors, and those are things that people are making choices on. And we want to know what your choices have been, your choices with regards to tobacco, alcohol use, other things as well. And it's really important for us to get the background on that because those factors are important in decision making. Even if they were in the past, that's fine, that's great, but we want to make sure that our treatment in the present matches your whole medical history, including these so-called lifestyle factors as well. Section 9 is your family medical history. And we're really focusing on blood relatives here. What I'd like you to do is think about your relatives individually. That's a better way, I think, to capture significant problems that run in the family. And so I'd like you to start to think about your birth parents. Think about them. And if they're living, we'd like to know their age. If they're passed away, we'd like to know at what age they passed on. If they had medical problems that were notable during their life, we should record those. If they're passed away, we'd like to know about their medical problems, but also probably what the cause of death was. I'd like to have you think about your siblings, your brothers and sisters. And if you have children with notable medical problems, we should have some idea of what those are too. Looking at the whole family medical history can sometimes make a difference in deciding the best approach to managing your problems. So now you've made it pretty much to the end. The last section looks hard, but usually it's easy. I want to be clear on what review of systems entails. Review of systems is a way to find out about any other symptoms that you're experiencing at this time. So review of systems doesn't mean have you ever had these symptoms in your life. What they're really asking here is what's going on now? Are you experiencing these current symptoms? And it's kind of broken down into sections. At the top, there's something that says no problems. Basically, that means there's nothing that would be showing up in that section. And if you don't have problems in that area, if you can simplify it and just say no problems. But if you go through, you should record any of those symptoms that you might have in those other areas. We've listed a lot of the common symptoms, but there may be things that you have that aren't on this list. And you can add those on, you should add those on. But if you could think about this section as not past history, like we've asked you up to that point, really I want you to look at what symptoms are going on now. And if you can get through this, you'll give us a lot of information. And once you get through it, you're done with our form. Thank you for taking the time to get this done ahead of your visit. This will really be helpful to both of us as we're going through your medical problem and making sure that we're making good decisions about setting a plan and looking at what treatments are available. Thank you, and we'll look forward to seeing you here with your paperwork in hand.